You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, this is Dr. Lori Marzell. Today I'd like to talk a little bit about osteoarthritis. Now, what is that? This is a type of arthritis or joint pain, which is usually referred to as a wear and tear type of arthritis. And the reason it is referred in that way is because it can result from overuse. This is why you see this type of arthritis in young people who are athletic, or in people who are have been running for years of their life. The joints start wearing out, they get inflamed, and thus you have osteoarthritis occurring. Now, a lot of different things can cause this besides or contribute to it besides just wearing out the joint. For instance, you can have someone who is sensitive to components in the nightshade family, which is vegetables such as tomatoes, eggplant, and white potatoes. Some people are sensitive to the components in this particular family, and this can manifest in joint pain, causing osteoarthritis for these folks. How do you test for that? Well, you simply, unfortunately, there's not a test that's been developed, and I don't know why there hasn't been. But usually we tell people avoid these foods for about a month and then bring in a whole bunch of them. See if your arthritis calms down, see if it comes back. Trial and error. Anyways, what does that have to do with hormones? Well, let's talk a little further. I'd like to discuss an interesting study that was presented at the International Menopause Society, which showed a number of women who were experiencing osteoarthritis prior to menopause and afterwards. In this study, it showed an increase in osteoarthritis as women became menopausal. Of particular interest was a number of women in this study who were given hormone replacement therapy after menopause. So what happened is the number of women who had osteoarthritis before menopause was at a certain level, and they showed a graph that was really neat with this. It increased as women became menopausal, and these women were put on hormone replacement therapy. And guess what? The osteoarthritis that they had decreased to the level that was seen prior to menopause. In other words, these women benefited from having estrogen replacement therapy. Their arthritis resolved to where it was before they went through menopause. It was very interesting. In order to understand this, we have to examine the role of estrogen in joint health. Estrogen receptors are in the joint cartilage, bone, synovium, muscles, and tendons. So it's really all over the place. Estrogen deficiency increases a reactive oxygen species which can damage tissues. Also, estrogen decreases pro-inflammatory cytokines. Women in the study of osteoporotic fractures who are currently using estrogen for at least 10 years were found to have a greater reduction in risk of osteoarthritis of the hip than users less than 10 years. This is a really non-toxic, easy way to decrease your joint pain. And oftentimes I see that doctors and patients don't understand that when estrogen levels drop, estrogen that's usually in your system from the start of about age 11 on, and when estrogen levels drop, inflammation increases. So the symptoms that you may see, that you may not think you will see, are stiffness, achiness, joint irritation, things like that. What a wonderful way to just add a little bit of a natural hormone to stop that inflammation and protect your joints. Patients often ask me how long they should take their hormone replacement therapy. I tell them that as long as they want to see the benefits, that's how long they should take their hormones. Thanks for listening, and hope you found some interesting information.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.